Hi, in this presentation, we are going to talk about Parkinson's disease, its pathophysiology and pharmacology. So, starting with its introduction, what is Parkinson's disease? Parkinson's disease is a neurodegenerative disorder characterized by progressive loss of dopamine producing neurons in substantia nigra. Substantia nigra is a region of brain important for controlling movement. Dopamine is a type of monoamine neurotransmitter. It acts as a chemical messenger and is made in the brain. It plays a crucial role in regular motor functions through a group of structures that synchronize voluntary movement called basal ganglia. Now, in Parkinson's disease, there is an impaired communication between basal ganglia and other parts of brain due to loss of dopamine. This results in common characteristics like rigidity, postural instability, tremors, bradykinesis, etc. There is an unclear understanding of exact cause of Parkinson's disease, but association of genetic and environmental factor is involved. Genetic mutation in the parkin, SNCA, LRRK2, and PINK1 genes are related to familial PD, that's Parkinson's disease, although these account for 10 to 15% of the cases. Environmental factors like exposure to heavy metals, pesticides are related to increased risk of sporadic PD. The common characteristics of Parkinson's disease is formation of Lewy bodies. These are abnormal mass of proteins, alpha synucleal, that gets collected in neurons. These deposits are considered to cause cell death. As the patient reaches later stages of Parkinson's, non-motor symptoms are also observed like depression, cognitive decline, autonomic dysfunction, and sleep dysfunction that badly affects the patient's quality of life. As the brain's ability to produce dopamine further declines, the Parkinson's disease patient experiences exacerbating disability. Now, here I've added a table that summarizes the key points of pathophysiology of Parkinson's disease in an organized manner. This is exactly what we've done on the last slide. Now, progressing on to the pharmacology of Parkinson's disease prioritizes the management of its main motor symptoms. Because the disease is caused due to loss of dopamine producing neurons in substantia nigra, the primary strategy for treatment would involve either replacing or mimicking dopamine effects. Considering the key medications used in Parkinson's disease treatment, I have considered levodopa. This is most effective medication for treating Parkinson's disease. Now, considering the class of this medication, levodopa belongs to the class of dopaminergic agent. It is forerunner to the dopamine, a neurotransmitter which becomes insufficient in patients with Parkinson's disease due to deterioration of neurons that produce dopamine in brain. Now, talking about the mechanism of action, Parkinson's disease is portrayed by loss of dopaminergic neurons in substantia nigra of brain. This causes a reduction in dopamine in basal ganglia that regulates the movements. Levodopa is used as a dopamine precursor as dopamine cannot cross blood-brain barrier itself. This medication crosses this barrier. An enzyme called L-aromatic amino acid decarboxylase AADC converts it to dopamine in the brain. This restores the dopamine levels that helps bring back balance between acetylcholine and dopamine that improves the motor control. This medication is mostly administered in combination with carbidopa, which is a peripheral AADC inhibitor. The conversion of levodopa into dopamine is prevented by carbidopa before it reaches the brain, which increases the amount of levodopa crossing the blood-brain barrier. Now, hopping on to the indications, this medication is mainly indicated for the treatment of Parkinson's disease. It is mostly helpful for the motor symptoms of Parkinson's like rigidity, bradykinesis, tremors, postural instability, etc. Now, in case of Emma, this can be beneficial as she reported similar symptoms. The nursing considerations, administration. It is administered orally in combination with carbidopa as previously mentioned. To enhance absorption, it is advised to take levodopa 30 minutes before and or 1 hour after the meals because the foods rich in proteins can interfere with its absorption. Monitoring for side effects. It can cause various side effects. Firstly, GI effects. Emma can experience nausea, vomiting, and anorexia, as these are the common side effects of levodopa. Secondly, orthostatic hypotension. This medication can cause low blood pressure on standing. So, if Emma stands, she might need a nurse to monitor her movement and educate her to stand slowly to avoid any kind of dizziness. We can also consider patient education for nursing interventions because the nurse should educate the patient about long-term effects of these medications, like various kinds of motor complications. Secondly, the nurse should also provide guidelines to manage these side effects as well. Now, here I've mentioned few of the links of the sites through which I've researched for the topic Parkinson's disease, its pathophysiology and pharmacology. Thank you.